All right, so now we're going to get into lung volumes and capacities, where we're going to talk about the different types of lung volumes and capacities. We're going to talk about spirometry and then look at some different lung diseases, restrictive versus obstructive, and then get into some disorders as well. So we got to talk about the volume, the amount of air that we can breathe, right, during just breathing in and out, right? And we can measure the rate of ventilation with a spirometer, right? So to understand the spirometer measurements, we first have to know these basic terms. So let's go ahead and look at some of these volumes. The first one is tidal volume, and tidal volume is just your normal breath in and out, right? You're not thinking about it, you're not doing anything, you're just the normal volume you can breathe in and out at any given moment. For most people, this is going to be about 500 milliliters. The inspiratory reserve volume, this is the maximum air you can breathe in over the top of your inhale during tidal volume. So you've made your normal breath in, and then the inspiratory reserve volume is everything you can breathe in past your normal breath in. All right, for the average person, and this is across male and female, on average we're looking at about 3 liters. The expiratory reserve volume is how much you can exhale out beyond your normal exhale out. So you've exhaled out normally, and then you force everything you can out. Everything beyond that normal breath out is going to be the expiratory reserve volume, and most people can do about 1 liter. And then there's about 1 liter-ish remaining. This is the residual volume. This is the air you just cannot breathe out. It is the air that must take up some space, otherwise your lungs would collapse. And of course, these volumes vary. This depends on how old you are, male versus female. Are you tall, big? Are you small? And then, of course, do you have any sort of diseases or conditions that could impact these? And so if we look at the lung capacities, where we're looking at basically 2 or more of these volumes added together, we have the vital capacity. The vital capacity is from the top of basically from your max inhale to your max exhale, which means it's the inspiratory reserve volume plus the expiratory reserve volume plus the tidal volume, right? The total lung capacity is all of that plus the residual volume. And then the minute volume of respiration is the total volume of air in a minute. So we're everything we're talking about here is what can happen within one respiratory cycle or one respiration. The minute volume is how much, what the volume of air is that you're taking in over the course of an entire minute. So we're looking at all the respirations you make in that minute, right? How much did you breathe? So we're looking at tidal volume. If we have 12 respirations per minute, we would take the tidal volume, in this case we're looking at 500, times it by the 12 respirations we could make in a minute, and we would get about 6,000 or about 6 liters per minute. And we can use spirometry to measure these things, right? Basically, we have a device that records the volume and the frequency of air movement on the spirogram. We can use this to diagnose certain disorders, like restrictive ones. And a lot of times what people, if they have one of these types of conditions, they will complain of a very specific symptom, which is dyspnea, which is a shortness of breath, right? They feel like they're just always slightly out of breath. So this is one of those spirograms, and so we can see here's the tidal volume. This is just normal breath in and out, right? Everything beyond is going to be on that breath in. That normal breath in is going to be that inspiratory reserve volume. Everything beyond the normal exhale out is the expiratory reserve volume. From this peak to this valley, right, all of this together is the vital capacity, and then the residual volume, which is down here, right, if we add all of those together, we get the total lung capacity. So let's look at some of these diseases, some of these conditions. One is the restrictive. This is where the lungs are damaged and they cannot stretch the same way. So we've lost volume or we've lost elasticity. And so we see that the vital capacity, the inspiratory reserve volume, and the expiratory reserve volume are reduced, but forced expiration is normal. So we can still force air out, but things that involve like deeper breaths and all that, and like the amount, the volume is going to be troublesome. And so we see this definition is like core to diseases like pulmonary fibrosis, emphysema, sarcoidosis, asbestosis. A lot of these have to do with like the fibrosis and the asbestosis are going to be exposure to environmental problems, right? Things that they've inhaled or breathed in that have caused a buildup of scar tissue. Obstructive, this is where the lung tissue is normal but the airways are blocked. So the vital capacity is normal, but the FEV1, which is like at 1 second, what's the forced expiratory volume, that gets reduced. And so this is going to be an example of things like asthma, COPD, cystic fibrosis, lung cancer. Usually we're looking at an FEV1 test for this. Again, we're looking at how much air can a person force out in 1 second. So the ratio of it is how much air compared to your forced vital capacity. So that's what we're comparing it against. That's where the percentage is coming, is we're saying in 1 second, the forced expiratory volume should be about 80% or higher than the forced vital capacity. If it's lower than that, then that's indicating that we have one of these obstructive conditions. Some other things, one of the big things, we can't escape the respiratory system without talking about it, but smoking. Smokers have difficulty breathing for a lot of reasons. The nicotine, the mucus production that comes from it, the destruction of cilia, which don't allow for that mucus to be moved properly. There's all sorts of chemicals in the smoke that can be irritating, and that we do develop scar tissue that replaces the more elastic fibers. We see that elderly people are more susceptible to conditions like emphysema, bronchitis, pneumonia. Speaking of pneumonia, that's going to be an infection in the alveoli. Basically, fluid and pus accumulates in the alveoli. This can be caused by several things, but the most common is bacteria. Tuberculosis, or TB, this is going to be an infection of the organism Mycobacterium tuberculosis. This is something that can spread from person to person, which is why you may have heard of people getting TB tests, because it can spread and it can really destroy lung tissue. This was something that was really common for people to get way back in the day, in like the 1800s or whatever. It was like weirdly romanticized. But it does cause people, it can be fatal if not treated. Coryza, which is the common cold. This is a whole group of different viruses that can cause this. It's not the flu, because we don't really see a fever come with it. There's a whole bunch of different viruses though that can cause colds. Some are coronaviruses, some are adenoviruses. I mean, there's a laundry list of viruses that are associated with this. And then in terms of reduced compliance, we have pulmonary fibrosis. This is because we have inhaled small particles that have created scar tissue in those lungs where the alveoli are. And so because that tissue is like scarred up, it doesn't stretch as much. You can't get that expansion that you need for a deep inhalation. Emphysema, this has a strong link with smoking, where the alveoli have actually been destroyed. And so we have reduced surface area, which means gas exchange is going to be happening on a lower level. And then respiratory distress syndrome, this is where we don't make enough surfactant. And so we see that we have trouble breathing because that surfactant keeps those alveoli and whatnot open. And if we don't have enough surfactant, those might not stay open. And this is really common in little tiny babies, especially those that are premature, because they haven't fully developed their respiratory system just yet. Because some of the really important stuff that you need for like the production of surfactant and stuff is something that is going to develop very late in a pregnancy. And so if a baby is born premature, they may not have been able to go through that process of developing those cells, developing the ability to make surfactant just yet. With obstruction, we have acute respiratory distress syndrome. This is where we have a leakiness in respiratory membranes, which means we get fluid accumulation and it's hard for you to get oxygen. Asthma, this is basically shortness of breath and wheezing. You have basically the smooth muscle in the bronchial tubes can spasm and they can close off. This is why albuterol and certain medications for asthma can work, because they will create bronchodilation, so it'll help open those things back up. A common trigger is allergies, although there's a laundry list. There's lots of different things that can trigger asthma. If you're like me, for whatever reason, my asthma is triggered by exercise. I swear I'm not making that up. And then there's cystic fibrosis. This is something you're born with. It's genetic, where the epithelial cells in the respiratory passageways, we're producing a thicker mucus. There's an issue with the chloride channels. They're not functioning the way they're supposed to be functioning. And so we get this thicker mucus buildup that makes it really hard to breathe. Lung cancer, this is where we have normal cells that are replaced with cancerous cells. This can cause tumors that can block off airways. It's really common for this to metastasize. And again, lung cancer is really strongly linked with smoking. So most cases of lung cancer we see are related to smoking. Not every lung cancer case is related to smoking, but a lot of them are. It's a really big risk to smoke because you do drastically increase your risk of lung cancer. And then COPD. COPD, or chronic obstructive pulmonary disease. This is where we have an obstruction to the airflow because the things are narrowing. There's inflammation, there's excess mucus, we get a cough, so that cough with sputum and mucus is going to be happening a lot. It gets exacerbated, it's hard to do things like exercise or whatever. That's going to be common with COPD. And then pneumothorax, this is a collapsed lung. I mentioned a collapsed lung earlier. Basically, there's some sort of wound that to the chest or the chest wall that has allowed air to enter into that pleural space. And remember, that pleural space needs to have a lower pressure compared to the inside of the lungs so that the lungs stay inflated. If we allow air into that space, we increase the pressure, which then will cause the lung to collapse down. So each lung is in a separate pleural compartment at least. So that means that if you experience this, most likely it's only going to happen in one lung unless your injury spans both. There are treatments for this in an emergency situation. There are things where we can use a catheter with a one-way valve. We just insert that into that pleural space, and that will allow the air to escape without being able to re-enter. And as the air escapes, the pressure in that pleural space will lower, which then will allow the lung to reinflate. Another big thing is carbon monoxide poisoning. Carbon monoxide is I guess you say a byproduct of burning of fossil fuels and whatnot. It's really common for us to be released by appliances or vehicles that are faulty. So if you have like a gas stove or water heater or whatever that is not functioning properly, it can release carbon monoxide. It's also what gets released by vehicles on a regular basis, and it's why you shouldn't run your vehicle in an enclosed garage. It does not have a smell. It doesn't have a color. And so it's really dangerous because of that, because you'll just start to feel the symptoms, which is a headache, weakness, dizziness, nausea. And then if it progresses, you can experience memory loss, confusion, psychiatric conditions, so you may hallucinate, and then cardiac injury. This is suspected when we see that the carboxyhemoglobin is greater than 10% in someone who smokes and 3% in someone who doesn't. The way we treat that is just to give somebody a bunch of oxygen. So we can use things like a hyperbaric chamber or whatever. Again, this can kill people, and it does kill people. It's also why we require now that in addition to smoke alarms, that people have carbon monoxide alarms in their homes as well. If you don't have one, you really should get one, because this is something that can and does happen in the home. And again, there is no smell, there is no color. So you wouldn't know until you were feeling symptomatic, in which case, if you're too far gone, you're not going to be able to actually get help for yourself.